I'm a resident of Leisure World retirement community here in Silver Spring. I'm a pediatrician during my working days. I'm medical director for the Emerson Clinical Research Institute. Also, on faculty at Howard, and I've really been impressed with the healthy Thursday classes that are held at Leisure World, given by the African American Health Program. Now, the Leisure World Association of African American Culture is a sponsoring organization, and they are the ones that really organize it. And we've really been fortunate to have the expertise that comes from African American Health Program. My wife and I, at the first session, got our blood pressure, glucose screening, cholesterol, hemoglobin A1C, as well as mental health screening. Just a very well done program. I understand that the African American Health Program received an award from the American Diabetes Association, Gold Star Award or something, for all the work they've done in diabetes. I personally was impressed that at my first visit, they gave me this Know Your Numbers card. That's in my first visit on 9/23. I was kind of cheating that morning and had a whole bunch of sugar, so my blood sugar was 214. Hemoglobin A1C was over 7.1. Blood pressure wasn't too bad. And at the about a month later, at the October meeting, I think you guys have gotten my attention. So I got my blood sugar was down to 106, and my hemoglobin A1C had already gone down to 7.0. But it was just so gratifying to see that I was improving, even in 1 month. And the little card they gave me is something that I'm really going to be using more with my patients. Telling all about cholesterol, know your cholesterol, BMI importance, and all that. So that's one aspect of the program that was personally gratifying and beneficial to me. Now, Rabina Barlow gave a cooking instruction in which she told us how to make vegetarian, vegan kind of meals. And we tried some of the menus that she gave us. Tasted pretty good. In fact, we really have been trying to eat more salads and cook more vegan since then, mushrooms and salads and all that. So that too has been a real benefit. I think the lectures, they have medical physicians that give lectures on various diseases. We had a lecture on multiple myeloma at the October meeting. And we just got notice that November 18th, the class is going to cover dementia, diabetes, and Alzheimer's disease. And those of us who've had Alzheimer's in our family, this is a very, very attractive course and beneficial for us to know. In this one, Rabina again will prepare food, and when she prepares it, you get a chance to taste it right there. And we're really looking forward. We do have some support groups for dementia and Alzheimer's at Leisure World, so this would be added value in terms of the expert information that we will receive there. So overall, I just want to thank African American Health Program, George McFarland, the staff of the African American program for all they do. Oh yeah, well just to know, for me to know my numbers and realize the importance of it has real impact on my patients. I teach at Howard University College of Medicine. I'm assistant professor of family medicine. So I will be emphasizing to my students, medical students and residents, the importance of health education prevention strategies that African American Health Program provides, because too often we focus on the sick care system in terms of the wellness aspect, and I think we're now shifting, and with the expertise from African American Health Program, I think we will, especially with the data that you're really getting. I really agree with the American Diabetes Association that this program is invaluable in showing how you can really get people off of medication. In fact, I've been able to reduce my metformin from 2,000 milligrams of metformin a day to one every once in a while. And so I think getting folks off medication, having them lose weight, especially, and losing the weight, that aspect of it, the healthy cooking, healthy eating, we do know that with COVID-19, obesity is the #1 risk factor, because COVID is a multi-system inflammatory disease, and it really attacks the endothelium. So where they have blood vessels, those organs can be affected. That's why it's multi-system. And even with children now, where we're seeing a lot of cardiac problems, Kawasaki and all that. So with obesity itself is an inflammatory disease in terms of those vessels which are impacted by cholesterol plaques and all that, is what really leads to the problems of strokes, clots, pneumonia, and death. So African American Health Program is a life-saving implementation of wellness and health education, which really needs to be replicated more. African American Health Program emphasizes that movement is life, and to see, if you come out to Leisure World, we walk and ride bikes, swim. I'm working on my golf game, so all these kind of things, just outdoors. So I think African American Health Program has really helped us better participate in all of these activities, and it's predictable that you have much better outcomes on that. And it's so good to be able to measure impact of your programs and have the data to really build on. So it's a well-structured, powerful program.